Even though medical science has progressed in many ways, young patients still suffer from apprehension and even physical discomfort in the diagnosis and treatment of illnesses. One of the most frightening procedures for children is undergoing an MRI scan. Magnetic resonance imaging, or MRI, uses a large magnet and radio waves to take pictures of organs and structures inside your body. Healthcare professionals use MRI scans to diagnose a variety of conditions, from torn ligaments to tumors. An MRI procedure can take a very long time, sometimes up to an hour. Inside the MRI tunnel, the loud noise and confined space can be very frightening for a child. The physical response of a frightened child can be fight or flight. Inside the MRI tunnel, a frightened child can become agitated and unable to lie still. When a patient is unable to lie still, the quality of the images is compromised. To get good images, the patient must be extremely still throughout the MRI scan. Anxiety during the MRI procedure can cause bad images. This means you have to repeat the MRI, which can cause even more anxiety in a person, and once again the images will not be good, and thus you fall into a vicious cycle. As the number of MRI scans goes up, so does the overall cost for the patient. Each MRI procedure itself can run into hundreds or even thousands of dollars, so getting it right the first time is very important. Very often, patients are simply sedated so that they remain motionless during the MRI procedure and everything works efficiently. However, sedation has drawbacks. A child may have to endure a painful injection in order to be sedated. Sedation can also cause disorientation, and many doctors are concerned with the danger of drug overdosage. So what can play therapy do? Many hospitals have formal play therapy programs with professional play therapists who engage children in age-appropriate activities to help them through the hospital experience. Play therapy is also used to explain and reassure children about the medical procedures they have to go through, such as MRI. Play therapists and child life specialists can help prepare children for an MRI by showing them a mock MRI setup, which explains everything they will experience. A child is usually taken into a special room which has a model of an MRI machine. Using toys, children are shown how they will be asked to lie down on a table and have their pictures taken inside a tunnel. The child life specialist goes through a checklist to prepare the child for their mock MRI. At the VU University Medical Center in Amsterdam, a study based on training children to remain still during a mock MRI showed highly positive results in the actual MRI. The overall mock MRI success rate was 94%. The quality MRIs obtained after this were 90%. The quality fMRI obtained after this were 70%. In the age group of under 7, the success rate was 88% overall. Through procedures such as mock MRI, play therapists engage the child's imagination. They are able to make a frightening procedure seem like an adventure. The space adventure theme appeals to most children. They imagine themselves to be astronauts in a spaceship rather than patients in an MRI machine. Some hospitals use videos to show children what MRI is all about. They demonstrate mock MRIs to explain things in a child-friendly way. In this video at the Florida Hospital for Children, a young girl is learning that the MRI machine takes lots of pictures. Child life specialists at Boston Children's Hospital provide families with detailed information packets regarding their child's MRI procedure. This includes links to sound bites of the noises the MRI machine makes. Parents are encouraged to make children listen to these sounds to prepare them so that they will be less frightened during the scan. Another tool Boston Children's Hospital recommends is the Oki app developed by the Royal Children's Hospital in Melbourne, Australia. The Oki app is an interactive way to understand the MRI procedure even further. In an ocean-themed game-like format, Oki the octopus navigates through a hospital and creates an MRI submarine. Imagining the MRI machine as a submarine is another way to let children's imagination take control and minimize fear and anxiety. Sometimes not all solutions have to be adult-sized. When Victor Tai, a radiation oncology nurse, discovered that a patient loved Legos, he thought of building a small Lego model of a radiation machine for him to help him understand the mechanics of his treatment. Working with child life specialists, Victor Tai has used Legos to make miniature MRI scanners. He believes they are more effective than mock MRIs, especially for children with special needs. The model makes it easier for children to understand the concept of the MRI and feel more in control. As we can see, play therapy can offer many options to avoid sedation when children must undergo an MRI scan. We have all the tools at our disposal to create sedation-free, happier healthcare.